My name's Dennis Akona, originally from Delta States. So I'm a licensed social worker and also a researcher. So one of my focus is community health, providing health services for marginalized community or people we know as key population. So I'm currently based here in Port Harcourt, and I'm the Deputy Executive Director for Center for Population Health Initiative. We have offices both in Yaba, Lagos, and here in the GRA of Port Harcourt. Yeah. So in terms, been in the public health field for about close to 15 years now, and I started as a community health specialist, then moved into research. So I did research for some time, then now I'm back to providing community health services again, at the same time doing research within the community. So Center for Population Health Initiative is a community organization that provides sexual and reproductive health services for vulnerable populations, populations that are at risk of HIV in Nigeria. So Center for Population Health Initiative started June of 2020. We were given birth to by Population Council. So Population Council is an international research organization that have been in Nigeria for decades, and they have their headquarters in Maryland in the US. So we were given birth as a local organization in 2020. So we provide healthcare services of all ranges, from family planning to providing treatment and screening for sexually transmitted infections such as gonorrhea, anal wart, syphilis, and other STIs that are out there. We also provide comprehensive healthcare services and treatment for HIV. So we provide HIV treatment and also testing here. So one of our signatures is also to provide the pre-exposure prophylaxis PrEP services, which is to prevent HIV infection. And we also provide PEP, which is post-exposure prophylaxis, which is also to prevent HIV after the intercourse. We also provide COVID-19 vaccines for community members. We also provide prostate cancer screening for men and cervical cancer screening for women also. So there are so many range of services we provide here. So this place is called Community Health and Research Center. That's the name of this facility, and it's popularly known as a one-stop shop. And a one-stop shop is like a place where you come to access all ranges of healthcare services. So in a situation whereby we might not have the specific services to provide here, we can also refer to one of our partners who also provide that services. So we also provide mental health counseling. We also provide all ranges of different services that might also not relate to HIV or related to health services. So yes, we are all part of the population, and key population are people who are more at risk of HIV infection. So these are people who have unprotected sexual intercourse on a regular basis, and such people are referred to as key population. So they have access to HIV services, and because of this, we provide ranges of services for them just to prevent them from getting HIV. In as much we talk about abstinence, we also talk about use of condoms. We also talk about PrEP. So PrEP is like the big deal now, and this is a medication you take once a day for people who are at risk of getting HIV. And of recent, we have what we call event-driven PrEP. So event-driven PrEP is a situation whereby you can plan your sexual activities, in the sense that if you're going to have a sexual intercourse or unprotected sexual intercourse in a day or two, you could start taking your medication like between 2 to 24 hours before the intercourse, then take another tablet, 24 hours in intercourse, and take another one again the second day after the intercourse. So there are ranges of PrEP services we provide, and reason why we call them, like I said before, the major reason we call them key population, because they are more at risk because of their sexual behaviors. So that is where the PrEP comes in, the pre-exposure prophylaxis. So it's a medication you can take before sexual intercourse, and we encourage people to take PrEP and also to use condom. So we say that condom is 99.9% safe and can protect you from getting HIV. But when you combine the PrEP medication and condom, for example, you have like 100% protection from getting HIV. And people might say, I don't have sex regularly, I only have sex once in a while. True, but you cannot predict at what time the infection is going to happen. It could be that first sexual intercourse, it could be the second one, it could be the third one. But we are saying that at any time you're planning to have a sexual intercourse, always protect yourself. And we are saying that if to the extreme you can't use a condom, there are medications you can take, which is a pre-exposure prophylaxis, for short, PrEP. Yes, so first of all, the drugs are very much available. You can access them in our facilities in Lagos and Rivers. So not just only us alone provide PrEP services. There are other non-for-profit organizations that also provide it for free. But we provide it for free here in Port Harcourt, in GRA, and also in our office in Yaba, Lagos. And you can walk in and everyone is eligible. So we have what we call the eligibility process. So when you come to access PrEP, we don't just give you the medication and say take and go. We have to assess your sexual behavior. We also have to do what we call the kidney function test, just to be sure that you're medically sound to take this medication and not pour more or add more to whatever medical condition, because we need to be sure that your body system is going to be compatible with the medication, and that's why we do the eligibility process. So once you go through that process and the doctor certify that yes, you're okay, and then we can provide you the medication, and it's free. It's free. So we don't collect money for PrEP from anybody. Every services we provide currently in our offices are free. Okay. So we don't collect money because we already have people who are paying for these services. We have the people we call the Department of Defense, DOD. They fund our programs, and we made it free for the whole community. Yeah, so there are some pharmacies across the country that sell PrEP medications, and I think that in terms of, so let me also speak about confidentiality issues. So for confidentiality issues, I would say that this is one of the best places you can access this medication if you are worried about your safety and you don't want anybody to know about you accessing this medication, because one of our objectives is to provide confidential services. So there are several ways we provide services. We can come to you or you can come to us. We can meet in a place that is safe. So not all the time, we have a good number of clients who probably for some reasons do not come to the facility to access our services. And that is why we have what we call the mobile teams. and the mobile teams comprises of some of our medical staffs, and they also go out to the community to reach out to folks. So in a situation whereby you don't feel comfortable to come to the office, we have our mobile team that can also reach out to you. And this is a place whereby people's records are very kept private. Even I, as the Deputy Executive Director, I don't have access to medical record of clients. I can't tell you this is the name of the client and the services. I can only tell you, okay, we have this number of people we provide services for, but I can't tell you their names, I can't tell you their phone numbers, because why? I don't have access to those records. These records are kept very safe within the organization. So we have a place like a safe house for this record that are kept under lock and key all the time. So records are kept safe. And of recent, we've added the weekend services, whereby if you're not comfortable to come within the week because of maybe the crowd, you can also schedule a Saturday visit, whereby one of our staff will meet up with you in the office and provide you services. One of the strategies we've used, especially during the COVID-19 era, we really did a lot by improving our mobile services, whereby we have people doing like door-to-door service provided. In terms of situation where we need to do refill for people, we have our mobile teams that go out to the field to do the refill. You don't really need to come here if you really don't want people to see you around. So yes, and there are also places you can get the medication. But what is advised that you don't just walk into any pharmacy. Please make sure this is a pharmacy that is registered and licensed to provide this medication, because we know that there are some people who have pharmacies that are not registered, but we are saying that don't just walk into any pharmacy or any shop you see close to your house. Make sure these pharmacies are licensed to provide or to sell medications. So no, we don't just provide medication, we also provide treatment. Like I said, we also do STI treatment. There are some treatment that do not need medication, that can be treated with either some little
lifestyle modification.
Yeah, so for instance, like I said, we do prostate cancer screening and cervical cancer screening here. So we don't provide medication for that, we do the screening, and we have a link with the BMH Australia to provide treatment where need be. We also provide mental health services. So mental health has been something that has become very popular within the country, and for us here, we provide counseling. Like I said, I'm a licensed social worker, so I'm also a therapist by profession. I was trained abroad, and I also provide therapy and counseling for clients that visit our facilities. So we do one-on-one sections, we do couples counseling or group counseling. We also provide what we call community dialogue, where we invite different community members to come into the facility to dialogue and have conversation around the issues that affect them. We also provide legal clinic. Of recent, we have like legal clinic. We provide services regarding to rape cases, or also provide services for extortion. We have situations whereby people are being blackmailed because of their HIV status, either by a partner or by a friend or by a spouse or whoever. So we have a legal clinic where we listen to these cases, and we have a lawyer who attends to these services. Then this place is also called a community center, whereby you can come in and feel relaxed, not necessarily accessing any medical services. You can be bored at home, you can be tired of staying at home. You might just need a quiet space. So this is a place you can come. We have outdoor games and indoor games. We have a lot of indoor games you can play, from Scrabble to Ludo to all types of indoor games. And we also have outdoor games like the snooker and the table tennis that you can have access to. We also use here as viewing centers in location basis. So in a situation whereby you need to watch a football match, or you want to, it's just a place you can just access comfort, and at the same time accessing comfort, you can also have access to free medical services and screening. So I talked about we providing mostly sexual and reproductive health services. It doesn't mean if someone has malaria or typhoid and works in here, the doctor can also provide some medications that are available. So we have a pharmacy here, and we have a pharmacist and a pharmacy technician that runs the pharmacy here in Rivers, and we also have same in Lagos. So we have a lab where we run most of our tests. I think the only test we don't run here is a tuberculosis test. We run it from our partner's office, the military hospital. So we have a lab here, we run most of our tests, and we have a doctor, we have nurses, we have community health extension workers, we have facility testers. So series of all medical staffs are available to provide unique services and very confidential services to clients. So I think at the earlier stage, COVID-19 was a very big problem because when COVID-19 came into play, we had to reduce the number of people who can access the facility at a time. We had to be very cautious so that we don't expose people to COVID-19. Then I think another challenge again, especially for our mobile team, security was a very big issue because they had to go into villages and some locations are not very safe to go. We also have a lot of clients who are working class clients, and most times the only time they are free is like on a Sunday, and we don't open on Sundays. That became like a challenge, and also the fact that most of our clients, most of the population we work with are highly mobile population, meaning that they move around a lot. So it could be that a client who is accessing HIV treatment from us today, and when it's time for refill and you're calling the client is moving, is already in another state or another location. So we need to not think of modalities of how to send the medication to this client. And I think because of the increasing number of clients that we'll have, we don't have like excess personnel or excess resources to go into the field at a time. There are times that we might have 1 or 2 or 4 requests of services or outreaches or event happening, and we can't be at all the locations at the same time. So these are just some of the few challenges that we are having. And as the client increases, we need to also increase our staffing in order to meet up with the huge number of clients we are having. Oh yes, as much as possible, as many as possible. We are capable. Like I said, we're expanding every day. In terms of staffing, we're increasing in numbers every day. So definitely we're already getting ready for more clients to come. And yes, if there are people out there who want to access any of our services, definitely they can come. We've not gotten to a point to say we cannot, because the universal goal is to have zero new infection of HIV, and we are all working towards that for 2030. So at this moment, until we get to zero new infection, we'll continue to work, and we'll continue to provide services for people so that everybody can have access, or everybody be able to know their HIV status, and for those who are HIV positive, for example, can have access to care and treatment. So we are ready to the task. think first of all, for everyone in this building, I think the passion is one thing that drives us. I think we all come from different communities, different culture, different tribes, different region, come together to provide this service. I think the passion is one thing that brought us together, because I tell people this is not something that is easy to do. I have staffs who take the risk of going into places that are very risky. Places that that there's possibility of kidnapping. I could remember the period of when we had the NSAS protest. Even as small the protest was going on and the community were unsafe, we still had our staff who were going out to provide services during that era. A lot of offices, hospitals shut down during COVID-19 peak period, but we were on. We had staff who were providing mobile services. For me, I say the passion, the commitment, there's this passion and there's this commitment to serve. I for one has always been that person that always want to provide services. Like I said, I have opportunities of doing things that are way bigger than this, but for me, this is where my passion lies, and this is where I want to be, and that is why I'm here today. And I know that yes, my rest of my team are also here for us to work together to provide these services. So passion is key, commitment is there. For us, this is a space where you have the ability to provide your services to the community for no cost. Like I said, our services are free. So it's part of that human service, giving back to the community you come from, or giving back to the community you belong to. So that's part of the drive. Yes, I think it's possible, because back in the day we were talking about 90%. Now we've moved to 95%. And I know that by 2030 it will get to 0. But right now we are working with 95%. Because the goal now is for us to make sure that 95% of people who are HIV positive are in care, meaning they are accessing services. To have what we call the 95-95, the 3 95s. So what that means is that 95% of people know their HIV status. So 95% of people who know their HIV status should also be in care and assessing treatment. Then also 95% of people who are in care assessing treatment should be virally suppressed. So when we say being virally suppressed, we are talking that the virus in the system should be suppressed to a very minimal stage whereby it cannot be detected, which what gave birth to the U equals U, which is undetectable equals untransmittable, meaning that when the virus cannot be detected in your system anymore because of you adhering to your medication, then you cannot transmit HIV. So that is the idea of the shirt I'm wearing, the U equals U. Yeah. So when you're undetected, you cannot transmit HIV. It means that the virus in your system is in a very minimal state that in the very minimal state that it cannot infect another person. HIV is real. There are people.
Obviously.
Yeah, there are people who are infected with HIV, and there are people also affected, like the family members, the friends, the community, and stuff. And we also run support group for people who are HIV positive. This is like a meeting, they come together strictly for people who are HIV positive to have conversations around adherence, to also talk about mental health issues, because mental health is very key. I don't think I've seen anybody who's HIV positive and the person is so happy. For us, it's a process for them, most of the people I've seen who are HIV positive, first of all, live in denial at that moment that it's not possible, because to them, they feel they've done everything right not to be infected. But like I said earlier, it could be the first time or the second time or it could be the third time. And it could be that there are people who have had unprotected sex for a couple number of times and they are still negative. But what we are saying is, at every given opportunity, protect yourself. Use a condom or use spray. There are people who are infected with HIV, so these are the people who live with HIV. And there are people who are affected, so it could be their family members, their partners, their spouses, their husbands, their children, their close friends. So those are the people, those are like the external people who are close to this person, who provide close care, yeah, the right word, so close care for this person. So they are the ones affected. So I would say that, so first of all, a lot of people are infected with HIV, find it very difficult to inform their close relatives or close friends or people around them about the infection. So they are scared of discrimination. So they are scared of being discriminated against. We heard stories of families throwing out their kids when they found out that their kids are HIV positive. There's a case right now that came to us about one of a client that is HIV positive, has been on medication, and I think one of the parents found out that the person was taking the HIV medication, and after confronting the child opened up like, okay, yes, I'm HIV positive, and the parent asked the person to move out of the house. And there's just this myth out there that coming close with someone who is HIV positive means that you can get HIV, which is not true. Or sharing the same cup or sharing the same spoon is not true. There must be a blood transmission before HIV can occur. So without this, it's not possible. So a lot of people are still so scared. Even for us as community healthcare workers, even when we go out to the field, people assume that because we are also HIV positive, that is why we are working in this. Oh yes. A lot of people have asked me that question. Oga, you be HIV positive, why you do this kind of work? You know, and I tell people, you don't have to be HIV positive to care for someone. You don't have to be part of that group or part of that community before you can provide care and support. I believe that care and support should be something it should be part of the qualities we have naturally. It should be part of the gift we have, providing support to our friends, to our family members, to our community. You don't have to, you must not be, you don't have to be someone from Obiako, for example, before you know you can provide care and support for Obiako. If you have the resources, if you have the skills, if you have the, whatever is needed, provide them. So yeah, so that level of discrimination is there. So imagine someone who is not HIV positive telling somebody else I'm HIV positive. There will always be that sense of discrimination, and people really get so scared informing their parents. But we've seen success stories. We have people who have close ones that, yes, and the close ones are aware. We have this, there's one of our clients who the mother knows, and the mother is even the person that reminds him all the time, hope you've taken your medication. We have clients who their partners, their husbands or their wives know about their status, and they are very supportive to them. But most cases it's always very difficult, and that's why we continue to provide counseling for these clients so that they know the importance. So we do not push people oh, you must go and tell. It's a process. It's a process where we allow the client to be comfortable enough to be able to talk to their partner or their close relative about their status. And we cannot, part of the confidentiality clause we sign, we cannot disclose anybody's HIV status. we cannot.
Everything.
Unless there's a court order. If there's no, aside that, we cannot. On no circumstances which we would disclose anybody's status. And that's why, I can beat my chest to say that this is one facility that provides, very good confidential services. Yeah, so for key population people out there, so when I say key population, I'm talking about people who have risky sexual behaviors, who has unprotected sex on a regular basis. So what I'll tell you is that if you're out there and you want access to free condoms, free lubricants, free prostate cancer screening, and free services that we provide, you can come to us and we'll definitely provide these services. If you are not based here in Port Harcourt or you're based somewhere else, you can also still reach out to us and we can link you to a very close facility where you can access confidential services, because we are like a network, in as much that I might not be programming in Owerri, for example, but I can link you to a facility that programs there in Owerri. So we have network of facility, and you can also go to our website. So our website is www.cphinigeria.org, cphinigeria.org, and you can also see the series of services and locations where you can also access the services. So for everyone out there who wish to also access our services, you can also reach out to us. Also tell some other people too. So if you know people who are key populations, or you know people who want to have access to prayer, if you know people who want to come for family planning, you know people who want to come for the hepatitis B vaccine, the COVID-19 vaccine, these are services we provide for free. So you can also reach out to us and you can also come to us for these services. Yeah, thank you so much and I appreciate it.